Hello doctors, this is Dr. Hira Salman. So welcome to MCQ of the day. So this MCQ states that in a patient with diabetes, which is the best antihypertensive drug. So here it's not, the age of the patient is not mentioned, and this is also not mentioned whether it's a type 1 or type 2 diabetes. So let's check first this nice.org.uk NICE guideline, which clearly says that, let me just click first this one. So this is this is NICE guideline based on type 2 diabetes. So see, step 1 treatment is offer an ACE inhibitor or an ARB to adults starting step 1 antihypertensive treatment who have type 2 diabetes and are of any age or family origin. So those patients who are having type 2 diabetes and they are of any age or any family origin, there you are going to use ACE inhibitors. Say for example captopril or an ARB, that is like losartan. So combination you're not going to use, whether you're going to use ACE inhibitors or ARBs. Especially for adults of Black African or African Caribbean family origin or are aged under 55 but not of Black. So any age or family origin, especially for this Black African or African Caribbean, and those who are having under 55 of age but not of Black African, again you're going to use ACE inhibitors. But if an ACE inhibitor is not tolerated, for example because of cough, we know very well that 7% of patients, they are actually having cough, productive cough as a side effect of this ACE inhibitors. In those patients you can convert this ACE inhibitors to ARBs, right, to treat hypertension. Now, do not combine an ACE inhibitors with an ARB to treat hypertension. So, combination we are not going to give. Offer a calcium channel blocker to adults starting step 1 antihypertensive treatment who you can use calcium channel blockers, but in which case? In the case if the patient is 55 or over but do not have type 2 diabetes. So it's clearly mentioned here you can use calcium channel blocker like diltiazem or verapamil, but only in those patients who are not having type 2 diabetes. Okay, so this is a very good graphic representation of this NICE guideline, and see it's 2019 if you can see. So it's clearly mentioned here. Choice of antihypertensive drug monitoring treatment BP targets. So hypertension with type 2 diabetes. So those who are having, who are actually type 2 diabetes patient with hypertension, step 1 you are going to use either ACI or ARB. In step 2 you can add calcium channel blockers or thiazide like diuretics. In step 3 you can add ACIs or ARBs with calcium channel blockers plus thiazide. And then step 4 you can use spironolactone if the potassium is like less than or equal to 4.5, or if it's more than 4.5 we are going to use alpha blocker or beta blocker. So first line ACI or ARB, any one. Step 2 you can use either ACI or ARB with calcium channel blocker or thiazide. So only two medicine here we will have 3 medicine because ACI or ARB with CCB with thiazide, and here we are going to add spironolactone or alpha blocker, so 4. So seek expert advice if BP is in control on optimal tolerated dose of 4 drugs. So if we have given 4 drugs, still the patient is not controlled, hypertension is not controlled, then you can seek expert advice, right? So this is a very good chart, and see this is hypertension without type 2 diabetes. I'm not covering this because our question is saying with diabetes. The question doesn't mention that whether it's a type 1, type 2, but if we are considering type 2, we have to follow this protocol. And let me show you, this is the guideline for type 1. Here it's also mentioned this is a group of development of guidelines group. It recommends renin-angiotensin system blocker, again this thing, ACI inhibitors as first line therapy, and they are recommended in NICE hypertension guide as first line therapy for people under 55, which account for most adults with type 1 diabetes and hypertension. So again, type 1 hypertensive patient, you're going to use ACIs or ARBs, right? And it's a very clear line. It's mentioned here, therefore it's sensible to recommend a renin-angiotensin blocker as first line therapy for all adults with type 1 diabetes if they have hypertension. So this is about the NICE guideline. Now if you're coming here, I just wanted to quickly show you this MTB portion. See, in MTB there is a question, but you can take this question, this important part here, that an AC inhibitor or angiotensin receptor blocker, for example losartan or valsartan, these are ARBs, is the best initial therapy. So ACI like captopril and enalapril, here it's mentioned enalapril like, is the best initial therapy for any degree of proteinuria in diabetic patients. So diabetic patient, it's not mentioned here, it's a type 1 or type 2, and in question also it's not mentioned, but we are using here ACIs. So they decrease the progression of the protein urine, delay the development of renal insufficiency. Hydrazine is not as effective as more adverse effect. So, and you can use this one. You can use losartan if there is productive cough, right? So this is the best next step here. So the important part here is, now you can again see there are certain other compelling indications of antihypertensive drug. Say for example, these are particular conditions. We are only concerned here about diabetes. Again, it's mentioned ACIs and ARBs we have to use. But if the patient is hypertensive and is having coronary artery disease, you can go for beta blocker, you can go for ACI and ARBs. If your patient is having benign prostatic hypertrophy and having hypertension, you will use alpha blockers in that condition. If your patient is having depression or asthma, then you will avoid beta blockers in these patients. If the patient is hypothyroid, you will use beta blocker first to control hypertension. If your patient is having hypertension with osteoporosis, you're going to use thiazides here. And if your patient is having proteinuria, again, like in diabetic patient, you will have to use ACIs and ARBs. So this is again very important. It's a part of MTB step 2 CK. So the question is about in a patient with diabetes, which is the best antihypertensive drug. So diabetes, we don't know either type 1, type 2, but we know very well that in both conditions, we have to use ACI or ARBs. So here captopril is ACI, right? This diuretic we are not going to use here, of course, is a thiazide, or if we need to use, we can use thiazide, but there are the conditions, right? Verapamil, again, calcium channel blocker. Diltiazem, calcium channel blocker, we're not going to use this. Propanol beta blocker, we're not going to use it. So here your answer is captopril, or if it's mentioned in enalapril, that's the best one. Okay, so answer is captopril. Thank you.